Dr. Richard Buckley here. I think you usually see this room from a different angle, but I'm on this side, and so you could see it from this angle this morning. This morning's project is doing something about those folds on the back that just love to get stuck down in what's called zones of adherence. So there's our patient here, and she had a zone of adherence here and another one here, and I'm going through those and releasing those zones of adherence with our ultrasound device, which is VASER. So first we numbed with 2 method anesthesia. Patient's awake? Yeah?
I'm here.
And at this time, are you comfortable?
I'm a happy girl.
Happy girl. Okay. And then we're vasering, so numbing first with the 2 method anesthesia. So our patient's awake and talking. We're listening to music. Carly Simon, I think, is on right now. And very important to have good music on. And we have, thanks to modern technology, basically any song we want or any artist we want or any album we want at our fingertips. Voice control. And so after I've done the VASER, then I will suck out the fat that I've loosened, which I'm going to keep because we're actually going to put some in the upper poles of her breast to get a little more cleavage, a little more fullness of the thinner skin that's on the upper, especially upper inner part, what might show above a bikini, for example, or a brassiere. We're going to put some of her own living fat in that area, and it'll be permanent. It's alive, so once it takes and established itself, it should be very happy there. And cells that are somewhere else that are persisting there and you don't like them there, we move them somewhere else. Okay, let them persist there in that new place. So that's very nice. So once we've done the vasering, loosen the cells, help to smooth out these zones of adherence and or adhesions. If you want, they're zones of adherence actually. And then we've gone through and sucked that loosened fat out. Then we're going to go back with the Renuvion device, which is plasma energy. There are 4 states of energy. There's solid, liquid, gas, and then there's plasma, a much higher state of energy. We have a little cute kind of fuchsia-colored wand that we move helium gas through, and on the end we create a plasma under the skin. And the reason for that is so that we can get some tightening of this entire back, get that skin that was hanging over the zones of adherence lifted up. Release the zones of adherence, get the fat knocked down, tighten the skin. That's the project on this side. Fat transfer on the other side. When we do those things, then we're going to move on to the arms actually and do some very refined sculpting liposuction on the arms and some more Renuvion tightening in a new area, the arms. Hello again, Dr. Richard Buckley, MilfordMD. Remember today's project is sculpting the back, tightening the back, getting fat out of the back, fixing the zones of adherence so the back is smooth and doesn't have folds and loose skin and fat. So I have numbed the back, and we have done the vasering to bounce the fat cells off, and we have done the liposuctioning to suck fat out, which we're going to transfer to the breasts in a little while. This gadget is the wand, the magic wand of the Renuvion device, and I'm going to show you plasma energy. It's going to leap out into my tool. Funny enough, it's sort of like a car engine kind of tool, but we actually use that to tighten something on the VASER. So you should be able to see this plasma jumping out under the skin. That tightens, and it comes out from both sides of this magic wand. I'll try and get it horizontal here. Let's see what we can do. Anyway, I hope you like that. And now we have a little poke hole here, which is, by the way, the biggest poke hole we ever make. It's to get our little protective ports that we use for the VASER device. The protective ports are this size. I need to get them through the skin, which keeps the skin from getting harmed by the ultrasound energy. But now I can take this wand and put it under the skin and do this. And there's helium gas going in there, which just made some stuff spurt out. And that gave a tightening treatment along that area right there. And I'm going to fan this out across this whole area. Do it on the other side. And then we're going to move on and do our patient's arms and fat transfer to the breasts. Renuvion for skin tightening. Thank you for watching. MilfordMD.